Hello, my name is Nityasri Vangala, and today my research will explore how we can face congenital anomalies in low and middle income countries. High rates of congenital anomalies in low and middle income countries are an omnipresent global health problem that can determine the fate of a population's health. But first, a little about me is that I'm a rising junior at William Mason High School in Mason, Ohio. I participate in HOSA, Red Cross, and student government. Some of my interests include biology, global and public health, and medicine. My aspiration for the future is to become a practicing physician. So, what are congenital anomalies? Congenital anomalies, also known as birth defects or congenital disorders, are structural or functional anomalies that are present at birth. This means that these anomalies are defects in how the body is built or in how the body works. Congenital anomalies can cause physical disabilities, intellectual and developmental disorders, and others. The most common congenital anomalies are cleft lip and cleft palate, heart defects, Down syndrome, and spina bifida. Furthermore, congenital anomalies can be fatal or lead to lifelong disabilities without the proper resources. The CDC states that congenital anomalies are the leading cause of death for infants during their first year of life. In low and middle income countries, or LMICs, congenital anomalies have a drastic impact on infants and their health as they age. Children in LMICs don't have access to preventative measures or treatment, giving them lifelong disabilities, functional limitations, chronic pain, and shorter lives, even though treatments to decrease this impact or prevent congenital anomalies may exist. Congenital anomalies are a global health issue because they disproportionately affect children and infants of LMICs, which can lead to the populations of these countries carrying a higher burden of disease. In my presentation, I will share the factors that lead to higher rates of congenital anomalies in LMICs, what has been done to decrease this rate, and what we can do in the future to decrease this rate. As we can see in this map, the mortality rate due to congenital anomalies for children under 5 in 2021 was as high as 300 deaths for every 1,000 children in low-income countries such as Sudan, South Sudan, the Central African Republic, Bangladesh, and many more low-income countries, mostly in South America, Africa, South Asia, and the Middle East. LMICs have greater socioeconomic disparities and suffer from greater rates of poverty, low-quality education, inadequate housing, and lack of clean water and sanitation. These factors are detrimental to maternal health and therefore increase the risk of adverse pregnancy outcomes such as congenital anomalies. Food insecurity during pregnancy can lead to a mother getting inadequate nutrition, negatively impacting the developing fetus. LMICs also have decreased education and health literacy rates, leading to a lack of knowledge of the importance of prenatal care, proper nutrition, and avoiding harmful substances during pregnancy. Inadequate housing and lack of clean water and sanitation can expose pregnant women to environmental hazards like air pollution, mold, and pests, as well as increasing the risk of a pregnant mother getting an infectious disease during pregnancy. LMICs are also less likely to have facilities and access to timely surgeries to treat reversible conditions such as cleft palate and clubfoot, which are anomalies that children can make a full recovery from with a timely surgery. However, an estimated 3.2 million children born with congenital anomalies are disabled for the rest of their life, even if treatments exist, due to a lack of access to these treatments. There have been increasing efforts to reduce congenital anomalies and promptly treat them. The Survive and Thrive initiative focuses on increasing care for newborns and further investing in newborns. Survive and Thrive commits to investing an extra 20 cents per pregnancy, which is estimated to save the lives of 67% of newborns by 2030. The Every Newborn Action Plan focuses on decreasing deaths and disability of newborns, as well as focusing on decreasing stillbirths, as an estimated 1 in 5 stillbirths are due to congenital anomalies. This plan does this through investing in and improving the quality of maternal and newborn care, educating families, tracking newborn health, and investing an extra $1.15 to save women and newborns. The World Health Organization resolution named Accelerating Efforts for Preventing Micronutrient Deficiencies and Their Consequences, including spina bifida and other neural tube defects, through safe and effective food fortification, urges member states to promote healthy diets, fortify food with essential micronutrients like iodine, educate citizens on the importance of preventing micronutrient deficiencies, better monitor congenital anomalies, establish systems for early newborn screening and diagnosis, and strengthening food supplementation and fortification measures. Creating new policies Furthering the reach of education and decreasing socioeconomic disparities are the greatest ways to prevent and promptly treat congenital anomalies. In LMICs, we can work with policymakers to educate them on congenital anomalies and work with them to mandate proven health measures such as salt iodization. For instance, approximately 1.5 billion people are estimated to be deficient in iodine, and mothers with iodine deficiency are at an increased risk of delivering a baby with an intellectual disability. However, mandating proven methods such as the fortification of salt with iodine has proven to reduce 720 million cases of iodine deficiency and has saved countless newborns from intellectual disabilities. And the next thing we can do is educate women. By partnering with nonprofits, global health initiatives, and policymakers, we can send representatives to LMICs to speak with pregnant women, mothers, and the general population about the importance of prenatal care, such as developing good nutrition habits, avoiding dangerous substances, and partaking in adequate sanitation measures. Finally, decreasing the socioeconomic barriers through aid such as food, supplements, and healthcare infrastructure can decrease the impact of congenital anomalies. Aid in the form of food can help pregnant women build nutritious diets and prevent congenital anomalies. Aid in the form of funding for health infrastructure and LMICs, such as hospitals and clinics, can allow for newborns to have immediate surgery to fix congenital anomalies before they take a toll on a newborn. Aid in the form of supplements can prevent congenital anomalies before they start. For example, providing folic acid, which costs only $2.13 per pregnancy, reduces neural tube defects like anencephaly and spina bifida by more than 70%. In conclusion, congenital anomalies are a serious global health problem that disproportionately affect low and middle income countries. The regular citizens, global health leaders, and policymakers who react to this problem play a vast role in how we can decrease the rate of congenital anomalies and provide adequate care for those with congenital anomalies. I urge you to think of one way that you can contribute to the fight against decreasing the impact of congenital anomalies, whether it be creating easy-to-read materials about prenatal and postnatal health in a different language for citizens of LMICs, reaching out to policymakers and LMICs to establish food fortification programs, or encouraging policymakers in your own country to give aid to low and middle income countries. You have the power to decrease the impact of congenital anomalies. Here are my references. I would like to acknowledge my family and my teachers for supporting me through this project and giving me valuable knowledge. I would also like to thank the Global Health Leaders Conference at Johns Hopkins University for providing me with the opportunity to share and advocate for this global health challenge. Lastly, I would like to thank the audience for your engagement in my presentation. Here's my contact information, and please reach out to me with any questions. Thank you so much for listening.